When I first started here, we were a very small hospital. The emergency department was just one room with curtains.
As a patient and as a parent of patients, I have watched the evolution of the emergency department.
Emergency room does so much and so fast.
An emergency department in a community like Good Shepherd is super important.
The 90s were a busy time. First, I had a piece of glass stuck in the bone of my finger. Then I brought my son Noel, who was severely dehydrated, and I brought my daughter Hallie in, who had an allergic reaction, we think, to shrimp. Then poor little Corey, she came in with a scratched retina from a keychain, a torn tear duct from a naughty kitty. Having a hospital nearby made me feel much more comfortable as a parent, and I trust Good Shepherd Hospital.
We are the immediate care for the community, regardless of what the problem would be. So if it's something from minor to major.
You always have to be ready. Sometimes they come in an ambulance and we get fair warning that they're going to be there in 5 or 10 minutes and you got time to prepare. But oftentimes people will walk in the front door with severe life-threatening emergencies and you have to have the skilled nurses up front at the triage area to pick up on that. We've had people come in and actually have a cardiac arrest in the waiting room as they walked in the front door. You always have to be ready for that. I personally have delivered a baby in the driveway.
We are certified as a primary stroke center. We've also been accredited by the American Heart Association. We've won the gold status and the honor roll for treating patients within 60 minutes. I'm very proud to say that we do it in 47 minutes at the present time, which is just outstanding.
We're a level 2 trauma center. We're an emergency department approved for pediatrics. We provide stroke care, cardiac care that you don't have to travel anywhere else for.
There are some illnesses, especially strokes, where time is of the essence.
I was up in the morning and I was working out in my basement and I wanted to talk to my wife. I couldn't talk. And she called 911. It was brought here to Good Shepherd, to the ER. That was probably the best thing that ever happened to me.
What we did in our department is when a patient is first recognized by anyone as having a stroke or the possibility of having a stroke, we call a stroke alert and the entire team is called. It's all about time. The sooner we could see you and treat you, the sooner we could relieve the problems and symptoms of a stroke.
It was brought here to Good Shepherd, and I was very fortunate. Dr. Joe Giangrasso was on work that day too. After I had the stroke, I had really lost a lot of my vocabulary. I had speech therapy about 18 months. I wouldn't be able to find a word I wanted to use, but she taught me how to navigate. I feel very good. It's amazing, I'm telling you. I'm a lucky guy.
I woke up, apparently I had a couple of seizures, asked my son to call 911. They wanted to know which hospital to go to. I remember just saying, get me to Good Shepherd. And they brought me here, found a brain tumor. Basically, Good Shepherd saved my life because that quick ambulance ride here got everything stabilized. They found the tumor, and I am deeply indebted.
The main reason that we are renovating and improving our emergency department is because medicine changes and we have to change with it.
So the new renovations are going to help improve the flow from the front door into the triage area and then either to the rapid treatment area or to the main section. The major part is the front end where the triage nurse sits. It doesn't quite work logistically as we'd like. It's a very noisy room and there's really a privacy issue.
We have what's called a rapid response area where someone could come in, and we found out using it during the past 10 years that it's a little small.
Opening up the rapid treatment area will help us get to the physicians and nurses to the patients quicker so we can start their care quicker. We're always working on improving our flow because we all know that when patients come in, they like to be seen as quick as possible.
It'll be much better for the patients. It'll be much more efficient, and I think we'll be able to see all patients in the emergency room within 30 minutes.
Part of the renovation also is for patient and staff safety. We're going to put cameras into the hallways and into other areas so we can better visualize what's going on because we do have a large space that it's hard to see everywhere. There'll also be badges with panic buttons on them so that if staff is in trouble in some way, they can push the button and we'll know their location immediately and we can get over to help them out.
Our emergency department is part of the community. We have grown with the community. We are here to help the community.
You have to keep up these days with medical care. It's moving fast, it's changing, and I believe as a community, we should do our part.